Hello, this is Dr. William Neal, dentist, periodontist in Wichita Falls, Texas. Today's lesson is on proper toothbrushing. First, a lesson on dental anatomy. Here we have a cross-section of a lower tooth like this, and you can see this might be the cheek side of the tooth, this would be the tongue side. We have a skin layer on the gum, you see the tooth, the jawbone, but we have this green biofilm slime that grows on anything that's wet and warm. And we're trying to focus right here on the tooth. So when you're brushing, you must use a soft bristle brush that's got to have straight bristle tips like this, not bristles that are splayed out such as this. So we want to take the soft bristle brush and we want to brush the teeth. We want to place the bristle tips on the tooth, not on the gum. So we're going to press the soft bristle brush, push hard, and we're just going to move the handle like this, back and forth, up and down, a little bit of circles any way you want to, but not like this. And certainly not like that. You go this way and you go that way on the tongue side. This you have to do by braille. This you can look in the mirror for most of that. So then we're going to use Grandma's tooth powder. It's been around for probably a couple hundred years. And so we have some baking soda that neutralizes bad breath odor and acid that causes tooth decay. We're going to use some hydrogen peroxide that will add oxygenating bubbles to that nasty anaerobic environment, and we're going to add a little bit of salt. So the way we do this, take a little bit of small glass, and we're going to add in about a teaspoon of baking soda. And like that. We're going to add in some salt and a little bit, not too much. And then we're going to add in enough hydrogen peroxide to make a paste. Something like that. So we're going to take that concoction and we're going to scoop up about half of that, and we're going to smear that on the teeth and the gum, all the way around lip side and tongue side, just like that. And that's going to do the job of adding oxygen bubbles to the anaerobic environment, absorbing bad breath odor, and all good things will happen. Bad bacteria hate that. And then so we're going to take that and we're going to rinse that. We're going to spit that baking soda out, but not rinse. And we're going to rinse out all the baking soda from the toothbrush. And so we're going to take that concoction and we still have some remnants of baking soda around the teeth. We're going to take our soft, hot, clean bristle toothbrush and try to drive that baking soda underneath the gum line like that. I showed you the technique before. This is where the really is the business end of brushing. I like the baking soda because it's cheap. You probably have it around the house anyway, and it's been time tested for decades. And the modern toothbrush products are mimicking that baking soda and hydrogen peroxide. So there you have it. I hope you enjoyed that. Hope you found it interesting, and hope to see you soon. Hey, thank you for watching. God bless.